Welcome to the LEAP Academy training on pandemic protocols and procedures. This is a mandatory training for all LEAP Academy staff on updated policies and procedures in response to the COVID-19 pandemic. It's important that you understand and can demonstrate all protocols in this training, so please find a space that allows you to be present and silence your cell phone so you can concentrate. Adherence to these policies will be expected and mandatory, so it's important that you understand them. There are two goals and objectives of this training. The first is that you'll be able to demonstrate and explain all health and safety standards. The second is that you'll be able to respond to parent questions regarding LEAP Academy's response to the COVID-19 pandemic. There are three areas in which we have updated our policies. They include new procedures for entering the building, daily procedures, and child-related procedures. Let's start with new procedures for entering the building. They include a staff daily health check, a fever swipe, changing shoes or removing them before entering the room, and washing hands for 20 seconds upon entering the room. Sanitizing is also acceptable. Staff and families will be greeted moving forward with a daily health check. When you enter the building, you will see a sign that says Staff Daily Health Check. Before entering, please read all criteria. If any of the criteria are untrue for you, you are not permitted to enter the building. Instead, please speak to a supervisor and return home. You must be able to say that the following are all true for you to report to work. I do not currently have, nor have I had a temperature over 100 degrees in the past 24 hours. I do not currently have, nor have I had any other potential symptoms of COVID-19, such as shortness of breath or persistent dry cough in the past 48 hours. I have not taken medications to lower my temperature. And there is no one in my household who has COVID-19. When you enter the building, please sanitize your hands, review the staff health check, and wait for another staff member to swipe your forehead to make sure you don't have a fever. The staff member swiping your temperature will record it for documentation purposes. You may then proceed to your room. Please limit the items you are bringing into the building to those that are essential for your daily functioning. A new procedure will be that staff and children must have outdoor and indoor shoes. Indoor shoes may be socks, slippers, or a separate pair of shoes that are utilized only when indoors at LEAP Academy. This practice is not only COVID friendly, but is a requirement for infant and toddler classrooms with City of Madison accreditation standards. Before entering the room, please remove your outdoor shoes and put on your indoor shoes, slippers, or socks. Please wash your hands for 20 seconds with soap and running water before doing anything else in the room. I recommend you use a mnemonic device or internal timer to get to 20 seconds. Some recommendations include singing the ABCs, Twinkle Twinkle Twice, or Happy Birthday Twice. Be creative, as you will likely get sick of the song quickly if you are following our procedures for when to wash hands. Please notice how Miss Aurora is scrubbing thoroughly and using a paper towel to turn off the faucet instead of her hands. The paper towel dispensers are meant to be pumped with a clean part of your body, including your forearm, to get a paper towel to dry your hands. Next, we will move on to daily procedures and practices. Updates in this area include eliminating access to rooms you are not working in, being encouraged to stay on campus during the day, elimination of mixing groups unless instructed by a director, practicing social distancing on the playground, the option of using a mask, increasing outside time and ventilation inside the building, increasing sanitizing and disinfecting efforts, and catching your sneezes and coughs in your elbow. Moving forward, you will be unable to enter a room that you are not working in. In addition, supervisors entering a room will sanitize their hands prior to entering. Doors to the inside of the building should remain shut. Feel free to stop by and give a silent wave through the window in order to say hi to those kiddos or coworkers that you would enjoy seeing. Second, we are trying to entice you to stay on campus during the day. This is not required, but the last thing we want is 20 teachers going to 20 different places for lunch and bringing back 20 different sets of germs. As such, we will be providing some free lunch options at Leap Academy. See your directors for more information. Next, we will not be moving children from group to group, nor putting groups together at the beginning or the end of the day. Parents have voiced to us their strong concern to limiting the number of people that their children are exposed to, and as such, we are going to try to honor this as much as possible unless we are in an emergency situation. This includes limiting outside groups to 1 per playground at a time. Next, you are welcome to wear a face mask to work if you would like to. Sometimes the staff have voiced wanting to wear a face mask, including diapering, where it's difficult to be far away from one's face, and feeding infants, where it's also difficult to be far away from one's face. Fifth, where feasible, we are going to ask that you increase airflow by opening available windows and propping outside doors where safe. Sixth, we will be increasing our sanitizing and disinfecting efforts throughout the day. In your rooms, you should have 4 cleaning spray bottles and ample paper towels for sanitizing and disinfecting each day. You should have a soapy water spray bottle, a water spray bottle, a sanitizing spray bottle, which is blue, and a disinfecting spray bottle, which is brown and is typically for bodily fluids. There is a difference between cleaning, sanitizing, and disinfecting. Cleaning is removing germs. Sanitizing is killing some germs, and disinfecting is an attempt to kill all germs. According to the CDC, bleach water mixed to a sanitizing and disinfecting level is an effective way to kill the COVID-19 germs that may be on surfaces. Throughout the day, please make time to sanitize common surfaces and toys, such as door handles and sink handles, and any toys used throughout the day. To sanitize, spray the blue bottle of sanitizing bleach water on the surface. Allow the sanitizer to sit for 2 minutes. If there is liquid remaining on the surface, please wipe it dry with a paper towel and discard the paper towel. Toys may be disinfected when there is a long period of time in between use, such as during nap time. Disinfect diapering surfaces and other bodily fluids by using soapy water, wiping clean with a paper towel, spraying water, wiping clean with a paper towel, and spraying the brown bleach water bottle. Allow to sit for 2 minutes, and if residue remains, wipe with a paper towel. You may also use disinfectant spray on toys at the end of the night and allow them to sit until morning. When you sneeze or cough, it's important to catch it in a disposable tissue or in your elbow. Please teach children to follow the same protocol. Wash your hands thoroughly after sneezing or coughing. Now we move on to child procedures. These include assisting children with hand washing for 20 seconds as they enter and before they exit the room, avoiding hugs and kisses, replacing with handshakes, high fives, and other safer touches, teachers serving meals, parents remaining out of the building, and nap mats being 6 feet apart and children sleeping head to toe where possible. Please assist and encourage children to wash their hands upon entering the room and before exiting, following the same standard procedures that we use as adults. Please note that hand washing is the most effective way to prevent the transmission of COVID-19 and must be done with soap and running water for approximately 20 seconds to be effective. Second, please avoid hugs and kisses. Replace these with high fives, knocks, or other ways to wave and say hi to friends. Moving forward, teachers should serve meals. We will temporarily suspend family-style meals. Before serving meals, please sanitize your tables using the 3-step process. First, spray soapy water and wipe dry with a paper towel. Second, spray water and wipe dry with a paper towel. Third, spray sanitizer, that blue bottle, and allow to sit for 2 minutes before wiping dry with a paper towel. Please note that children may not have access to the blue or brown bottles that they contain bleach. Next, wash your hands using our standard hand washing protocol. Apply disposable gloves when serving food. Lastly, please sit and enjoy this time with our children. You will note that parents will remain out of our classroom space for the foreseeable future. Children will also be fever swiped at the beginning of the day and again at 3 p.m. by an administrator. An administrator will escort each child to his or her room. At the end of the day, an administrator will pick each child up. Each child should wash his or her hands, gather materials, and exit the building to his or her parent. This change makes it increasingly difficult to communicate with parents on a daily basis. Please take regular care to find alternative ways to communicate with parents, the parents of the children in your classroom, such as sending an email, giving a phone call, or sending a note home about great things happening in your classroom. Remember to confidently greet each parent by name when you see him or her. Lastly, wherever possible, please put nap mats down approximately 6 feet apart or 1 cow length and have children rest head to toe. This completes the training. Remember, it's only together that we can prevent the spread of COVID-19 throughout our center. At this point, please complete the last assignment and submit it to your director, which is, in your own words, in 1 paragraph or less, explain what Leap Academy is doing to prevent the spread of COVID-19.